Human and Social Services Committee to order. And the first item on the agenda is the approval of last month's meeting. So if someone would like to make that motion, Ron, second by Supervisor McDevitt. Any corrections or additions? All those in favor?
Aye.
Aye. Opposed? Carried. And with that, it's up to you, Rob.
Okay, thank you. First item I have is a list of 4 individuals whose current terms on the Community Services Board are expiring, and all 4 individuals have indicated a willingness to continue into a new term, so I'm bringing these names forward for reappointment to the Warren County Community Services Board for a 4-year term to run January 18 through December 2021.
All right, would someone like to bring that to the floor? Supervisor Bramer, second by Supervisor McDevitt. Any questions? All right, all those in favor?
Aye.
Aye. Opposed? Carried.
Very good, thank you. Next item I have is a request for our contracts for 2018. These are the amounts that were in the Warren County budget approved on Friday. There's an attached Schedule A that lists our contract agencies and the amounts, the budget codes. This is just the approval to go ahead and set up the contracts.
All right, someone like to bring that to the floor? Supervisor McDonald, seconded by Supervisor Montesi. Any questions for Rob? All right, all those in favor? Aye. Opposed? Carried.
Thank you. Next item is a request for approval for contract with White House. This is a little bit different because we don't do quarterly advances for respite services. We have a line in our budget where we pay for overnight crisis respite at the White House, and they voucher us on a kind of as they use the service, and we draw down on the line. So it's paid a little bit differently, so we put it on a separate resolution request.
All right, someone like to make that motion? Supervisor McDevitt, seconded by Supervisor McDonald. All those in favor?
Aye.
Aye. Opposed? Carried.
And the last item I have is a similar request for Northeast Parent and Child Society. They do both overnight and hourly respite for us, paid out of the same line. And again, because the payment provisions are a bit different, that's why there's a separate resolution request.
All right, motion made by Supervisor Bramer, seconded by Supervisor Montesi. Any questions? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Okay, thank you very much, Rob. Have a nice
Thank you,
Thanksgiving. Did you have travel on this one? I didn't see anything in mine either.
Good morning.
Good morning.
Okay. Not sure how to... There we go. I thought it would be helpful. I didn't have any specific business this morning, but I do have our... youth employment program. I thought it would be helpful just to go through our performance for the past year. And this idea came out of the personnel committee meetings. And usually I come to the committee about 5 times a year, only when we get business. So one of the comments was it would be helpful to provide more information on the program. And I can't find mine. I apologize. Anyway, all that's on here are pictures. I thought it would be helpful to show pictures from the picnic. It was just too much. There we go. Okay. and it should rotate. These are pictures from the past year from our youth employment program, and I have in the package some of the numbers from the past year. And the first sheet on page 2 is the summer youth employment program, a listing of the work sites that we had. We had 45 youth in the program this past summer, and they worked out of 20 different work sites, and you have the list here. A couple of them that I did want to point out specifically is the Warren County Work Crew. This past summer we hired a work crew supervisor who went around with between 2 and 6 of the youth and did different projects throughout the county. Did a lot of work here at the Municipal Center that otherwise wouldn't have been done, and also did some work up in Chester, working on some of the hiking trails up for the town. And they also worked at Cornell Cooperative Extension in Warrensburg. You might remember back in April, we said we were going to start that again this year, and if anyone had work to let us know. Our 2 youth programs that we run are very different in terms of eligibility. The Summer Youth Employment Program, this is state funds that come through DSS, and they're awarded to DSS, and then they assign the funds to us to actually run the program. So starting in April, May, we go out and do the recruitment, mostly in schools, and most of these 45 youth were in-school youth, and that is directly different from our year-round program, which is the next page on page 3. Our year-round program, that's funded through the Workforce Innovation and Opportunity Act, and the criteria for eligibility is very different, and because of that, most of the youth are actually out of school. Most of them are dropouts. Just to give you some of the eligibility criteria that we have to comply with. The first one actually is a youth dropout, pregnant or parenting. We have a lot of the youth who are either fathers or mothers. They have to be low income, have a disability, be homeless, a homeless individual, a homeless child or youth, or a runaway. In our summer program, we actually had 2 of the youth were homeless at the time of entry, 5 from foster care, and we had 5 with a disability. So we tend to work with, children that have, we call them barriers, either to employment or to education. Just to quickly review some of the work sites for the year-round program, we had 18 youth during 2017 that were enrolled. This error message came up. Oh well. So I thought these pictures would be a good idea. We tried them on several different computers in our office, and it ran perfectly as a slideshow.
That's the way it goes.
Yeah, that's the way it goes. So the 18 youth in our we call it the year-round program. They would include youth who are in the task program through BOCES. We started this fall with 12 youth, and that number goes up and down. During the course of this year, we had 8 new youth enrolled in the task class. During the course of 2017, we had 13 attend. We had 4 students sit for the equivalency exam, and all 4 of them passed. That was last spring. One of the more interesting things for the past year is, and this is a cyclical thing that goes up and down in terms of the youth. In our summer program, we're required to serve youth as young as age 14. The year-round program, they have to be at least 16. But we had a number of 14 and 15-year-olds. Almost half of our summer program this year were either 14 or 15 years old, 21 out of the 45. So there is a little age difference, too, between the 2 programs. The summer program, they tend to be younger, whereas our year-round program, they tend to be older. We have a number that are actually in their 20s. We can serve youth up to the age of 24. And, so when they come into our office for an assessment, we can either treat them as an adult or treat them as a youth. it really depends on their needs, which program we place them under. If they need their task diploma, obviously we treat them to youth. That'd be the first thing to accomplish.
Question, Ron?
What is Operation Food Chain? You had 10 employees there.
Yeah, thanks for asking. I wanted to point that out specifically. So that's the program that we operate in conjunction with BOCES and Community Action. Community Action purchases food. We contract with BOCES to hire their chef, Matt Young, and they actually prepare lunches every morning, and then they serve them to the city youth program in Eastfield. And we have about 10 youth each year that participate in Operation Food Chain. It's a great program. And, you know, it's to serve disadvantaged kids who otherwise wouldn't get a healthy lunch. But more than just prepare the food, our youth, it's really more of a mentoring program, but also you know, on-the-job training, because they're taught how to order the food and, you know, do all the preparation and planning and everything else.
This is based at BOCES facility.
Yeah, they down at Dix Avenue.
Yeah.
They meet there every morning, and then we actually pay for a van. They pack up all the food. If the pictures were working, you'd see pictures of the van from the summer picnic. Any other questions?
Yes, committee members, any questions?
Actually, here's pictures.
Got any kids that know computers?
Yeah. Well, what's interesting is, you know, anyone that works with youth these days, they're really not that good with computers, but smartphones, they're a whiz with their smartphone, and they can do stuff that makes sense. Yeah.
Any other questions? I think it's a wonderful program. I always enjoy going to the picnic in the summertime. It's great to see how excited those young people get when they get a trophy or a certificate or something.
Here's a picture of it.
Oh, okay, good.
They actually, BOCES actually purchased signs to place on it, so that get a little advertising out of the deal. And of course, this is one of our youth. This person here is our work crew supervisor that we hired her. So he's now a security guard at the college.
Oh.
Summer's off. It's a perfect fit for us and him. Maybe this is what you have to do to start the call. But anyway, there's no other questions. Thank you very much.
And thank you very much. Good. All right. We'll move on to social services. Cynthia and Julie. Is she coming?
No, I usually do. Good morning.
Good morning.
So I'll try to be quick as well. We only have one actual agenda item and then just a couple of announcements, and then Julie can go over the budget. The first one is Commissioner Schmidt had asked previously for a resolution with regard to our resource assistant position. As you may recall, what we ended up doing was posting the job as a different position, resource coordinator. Because it's taken a while to do that, we actually hired back a couple of days a week the prior resource assistant. We did have an end date in the original resolution of November 21st. However, our hiring process is still going on, so we're just looking to amend that resolution or ask for a new resolution in regard to that. So that's a little bit of background. So the request is to either extend or remove, whichever is more appropriate, the date of November 21st in order to have her continue to come back when we get the new person hired to review the job with that person.
Someone like to make that motion?
Shall we,
Let's bring it to the floor, and then if you have questions.
I would bring it to the floor to extend or to knock it out.
All right, so we'll have the motion by Supervisor Leggett, a second by Supervisor McDonald. Now, you had a question.
Okay. Are we extending it, or are we just deleting it altogether?
Which are we doing, Cynthia? Extending it, or?
I would like to just delete the date. We actually don't even have a person hired yet for the new position. The person that's coming back a couple of days a week is willing to come back as long as we need her. So what we really want to do is get the person on board, considering it's the holidays. We don't know when the new person is going to be able to start. So I'd hate to give another date and then have to come back again. We really hope to, once the person is hired, only have 1 or 2 weeks where she would come in and assist the person in the resources coordinator position.
So basically, it's then to eliminate that date.
I would say yes.
Is that okay with, okay, is that all right with you, Matt? Okay. All those in favor? Aye.
Aye.
Opposed? Carried.
The only other thing I wanted to mention in the Commissioner's absence is we are anticipating funding, I think either she or I had mentioned before, from the state in the amount of $30,000 to plan and coordinate a program on sexually exploited youth. We're in the current stages right now of doing the plan and the approved budget for that $30,000. The way it's going to affect our budget in January, it will be available to us as soon as the proposed budget is approved by the state, but it's going to come through the youth development program. So all we're going to need to do is adjust our budget sometime in the beginning of the year.
Right, next month I will submit an amendment to the 2018 budget because this won't happen until 2018.
Okay. So that sounds good. All right. Is that it for you, Cynthia? Okay, Julie? Thank you.
Okay, as far as our overtime goes, we try to keep it as limited as possible. Really depends on the number of calls that we get for our CPS unit and our after-hours on-call. So we're going to come over last year, we already have, and we're just going to try to keep it as low as possible. I've moved enough money in there to cover for year end, so it should be okay.
Okay.
And revenue and expense, I don't know if anybody's had time to review it, but again, I don't
All right. Committee members have any questions?
If I could add one thing. to
Certainly.
What Julie said about, the overtime and the caseworkers. Just so you know, the months of September and October, we've gotten almost 50% more phone calls for CPS.
Really?
Yeah, reports, that is, from the State Central Register. So they're extremely, extremely busy right now. Almost 150 calls in the month of November. Yeah. So if we're up overtime, I know we're trying to keep it low, but there is a reason for that.
All right.
What are the nature of the calls?
a lot of safety assessments.
Yeah, it's calls that are made to the State Central Register. They are cleared by them before they're forwarded to Warren County. So this is just the calls that come into our local unit.
Cynthia, we have to come back to that resolution that you had. Amanda brought it to my attention that we have to have some date in there, even if we move it off until January,
Sure.
but we have to have a date in there.
Okay, can we say January 31st, 2018?
That would be fine. So we're going to have to make an amendment to that. Craig?
Yes.
That's all right with you? Matt? That's all right with you? All right. All those in favor? Aye. Opposed? Carried. Thank you very much. Okay, gals, thank you very much. Oh, I'm sorry, Craig has a question.
I like your little arrows on the top of the column.
Usually I try to make clean copies before I send them upstairs, but committee, I didn't get a lot of notice, so I just kind of...
That's all right.
I need them for me.
It works out now well. So it looks like on the expenses, are we well under projected, or...
No. we're going to have a lot of expenses coming up. As soon as we pay all of our institutional, our contractual payments that we've been waiting on. So I don't know if it's over budget, but we certainly started.
About $8 million left,
Yes. We have several
Department goes
payments
through.
pending. I'm
It
hoping...
takes us 2 years to spend $8 million. It's too much.
Yeah, I'm hoping over the next few months that's gonna even out as contracts come in and we start paying our institutions.
And then same with revenues, there's revenue.
Same with revenue. A lot of the 2017 revenue is gonna come in 2018 because we spend it now. We claim it a month later, and then the state reimburses us 3 months after the claim. So what you see right now through December for 2017 revenue is going to be low. But starting in 2018, I run both reports. I do a 2017 report and I do 2018. And you're going to see the 2017 revenue go up the first several months of next year.
And that can get booked 3 months into the 2018?
Yes, what we do at the end of December, we book any payments that we haven't made yet, but were incurred in 2017. Same thing with revenue. We book anticipated revenue for 2017 with the Treasurer's Office.
Any other questions? Claudia?
Thank you. What is the status of the commissioner?
We have her letter of resignation. Other than that, that's all I know at this point. I haven't heard anything. I know Rachel and I talked about it once, but we haven't done anything as far as moving forward at this point to find a replacement.
Would that go to personnel then, or is it something?
I'm assuming at some point it has to come to personnel, right, Amanda? But we also have to work with civil service on that.
Oh, okay.
So they're involved in the process, I understand.
In this committee, yes or no?
I would assume we would certainly have some information. Let me see what I can find out.
Thanks, I didn't know that there was a letter of resignation.
Well, I was told there was, yes.
Correspondence in, I think, October.
Oh, see, she read it in correspondence.
No, you read very quickly.
It was sent out.
All right, I'll see what I can find out and try to get back to you with something. All right. If there are no other questions, I guess that's it for social services. And thank you very much, ladies. Have a nice Thanksgiving. All right, so what do we have? I didn't realize they were on there. Did I miss something?
Of course, they weren't going.
That's a big high-paying position.
I'm going to keep my mouth shut.
Oh, okay. So let me see what...
That's something.
Good morning. How are you?
What's up? Something happened? Something happened?
Oh, well, I have a meeting back in Vegas. But as long as you're going to be... Okay, so I will keep that together. Good morning, I didn't realize we were... Yes.
Hopefully get your signature.
Oh, you can get that.
Well, you know, Kevin isn't sitting at the... He would have
You're
an answer.
welcome. You get this, or does a man? You got it.
Already lined up to do.
Oh, somebody else. Enjoy. Okay.
Isn't Cynthia?
Okay, we're all set, Pat.
Okay. Morning, everybody.
Good.
Morning.
I don't think we have a whole lot to keep you here all morning, so we'll go ahead and get started. The first thing I guess we can write this in.
We're ready. Excuse me. Thank you.
First thing on our agenda this morning, we'd like to request a resolution to appoint Dr. Bill Vargas as the medical director for the Division of Homecare and appoint him as a member of the Professional Advisory Committee effective January 1st. And he's going to be replacing Dr. Ruggie, who's retired, which we knew earlier in the year, so We're all set there, no changes in job duties or finances. The contract will remain with Hudson Headwaters.
All right. Someone like to make that motion? Supervisor Montesi, seconded by Supervisor Leggett.
How much is
Discussion.
the contract for?
Medical direction services, which we have to have.
Yeah, how much?
How much
Is there a
is it?
dollar amount?
Yeah, it's like $5,000 a year, paid quarterly. And it's not a lot of work, but in the event that we need them to, like, speak on TV on our behalf or something like that, we just have to have it.
Thank
And
you.
it's good to do it with a practice that has backup physicians too, so. there's
Right.
no-
All right. All those in favor?
Aye.
Opposed? Carried.
Okay, moving on, Ton, would you like to discuss our budget transfer?
Your last page, which is your attachment number 5, are the best that I could do at this point, being it's the end of the year. Basically, all of these are just moving some money that needs to cover some salaries and some fringe benefits to get us through the end of the year. We've had to move some people that full-time is out right now, so we're getting some more part-time to help us, and you know how we work it. We try to get everyone to help out. So this is just moving some money to get through to the end of the year between most of our programs. So the total is $21,985.
I'll move that, Mr.
All right,
Chairman.
second by Mr. McDonald. Any questions? All those in favor?
Aye.
Aye. Opposed? Carried. May as well, if you're there, that's fine with us.
Other financial pages, attachment 2. I do want to bring to your attention, I called this morning, Kathy, one thing, just the total budget down at the bottom of the sheet that says $3,183,952, that's for our salary. You'll see up above 2017, the budget is actually $3,181,952. Because of the transfers I did in the last month, I forgot to update the numbers below, but the percentage of the total is barely changed. Right now, year-to-date, we are at 72.2%. I have 72.16, so it only changed it 0.6% of the budget. And last year at this time, we were at 84.27%. So we're again 12% under budget and salaries right now. And then on attachment number 3, which is our comparison this year to last year at this time, you'll see again our salaries that were down. Our part-time is up because we're using our per diem, which has been obviously a saving. Our overtime right now, we're down, which again is helping with the per diem being utilized, and of course our full-time salaries. Equipment, just noting some things that we bought this year compared to last year. I think it was a car, it's a big difference. And contractual, our normal expenses, they are slightly down, again due to timing of our preschool is really our big program with a lot of expenses to those, but that'll all be caught up by the end of the year. And our employee benefits, of course, are down because we're utilizing per diem, so that's saving up in those benefits.
Question. Supervisor Leggett.
$365,000 is just slightly down on contractual.
Well, per diem, it's a $3 to $4 million. Right, that's, I'm sorry, not per diem, I mean preschool program. That's a $3 to $4 million program, so $365,000 is a month or two expenses. So, yeah, it could be, with everything else. And the other thing, too, is when we're down with, like our therapists possibly, I mean, it touches a little bit of every department, but our preschool program is the big one. Like I said, I use this always as an example that our prospect school, for example, is $26,000 a year for a child to go there, 10,000 or so to buffer for like $36,000 to $40,000 a year for one child. So if you've got 10, 15, 20 child in 1 month, our bill could be very big. So it's just due to timing getting that into the system. Yep.
Question, Supervisor Montesi.
I see revenue is down $250,000 for this year. Did we plan next year another decrease?
I think we kept it fairly consistent with our preschool and the early intervention programs. That's one of those that we really, we try to keep it up there where, because like I said, the expenses in most cases do go up. Our child program, which we don't have one thing just to say, is in this numbers too, part of that is the long-term care program. We had that for half a year last year. We don't have it this year, so that's a comparison within those numbers. And our home care is down in revenues, but like I noted too, also our salaries, if we don't have the work to print, we don't get the per diems to come in. We try to keep those salaries up too, which also will also save on supplies, which our supplies are down this year too.
Well, I mean, there's more competition in that home care field, and I'm just wondering how much more of an impact it will be on us.
Well, that's very difficult to tell because as much as there's a difference and we have a lot of competition, a lot of our patients are going into managed care programs. So that doesn't matter what agency they're with, they're still in a managed care that says, where before we could see them as long as we feel the need. Managed care dictates now how long we can be in there, which is going to affect revenue, as well as both Medicare and Medicaid have decreased 2%. Okay. So it's not, just how many patients we're seeing, it's the restrictions that are put upon us over things that we cannot, control.
Thank you.
Any other questions? All right.
Okay, moving on. You'll see meetings attended. We did get the permission slip signed and all the information was transmitted. Tammy and Val attended the Home Care Association Quality and Technology Symposium in Suffern last Thursday and Friday. Funds were available. I think those kinds of things are always good. You come back knowing that we continue to have lots of work to do, but it's good we have to keep, not that we're behind, but
keep on top.
We got to keep on top of it.
That's great.
Okay, and we're past the expenditures and revenues. You'll see attachment 1 is the Emergency Response and Preparedness Monthly Report. Anybody have any questions on that?
This goes according to a plan?
Yeah, we have to meet certain deliverables in order to get the monies that are from the grant, from the DD program. And moving on to status of referrals, on number 4, you can see that this in September we were up, and again these numbers are good because you can see that it's an up and down kind of thing, depending. Every month is a little bit different, but we were up quite significantly in September.
Total per year?
Total, we're,
On that one there.
yeah, we won't get that until the end of the year. We'll do and that's why we do the comparison charts. Well, do you have any comments that you want to make regarding that?
As far as the numbers?
Yeah.
No, I think it's pretty much taken care of in what I, had said.
Right.
I know staffing, or not staffing, assessment at Central Hospital, the beginning, but that won't affect the September. I know for October, the first 2 weeks, they were way down. And it just fluctuates. We don't really refuse any referral that comes our way. And we've tried to work a lot with Hudson Headwaters. Hudson Headwaters has a system that when they want to send out a referral, which we do get tons of referrals from them, it goes through a computer system. It's called an Althena. And what happens is it goes to all home cares. So there's times where we'll go out and see a patient, and that patient might have belonged to another home care agency, and they don't have a way to track that. The same as, they may be in there and we go out there. So it's whoever gets it first, but, we did speak to Dr. Vargas at PAC the other day as to how something, but he says that this time they don't have any way, to control that. But any referrals that do come to us, we do get out 24. Rare is it that we get out in 48, and some of the other home care agencies, their liaisons will take the referral, but they're not getting out in a timely manner, and that's one of the things. So the meeting that Tammy and I went to last week, there were other staff that do the same position that I do there, all trying to, they're learning the latest and greatest, and they're basically, some of them are saying that they are not getting out in a timely manner. I know Albany Med, the bigger hospitals are calling and saying, we love working with you because you're getting right out there. So we do the best that we can, and we don't cherry pick our patients and some of the agencies, because if you see a patient under Medicare that is 4 visits or less, you only get paid for each visit, which means it's no money, so to speak. Those other agencies will not take those patients. But, we have, a philosophy here that we cover the patients with more time.
Supervisor McDowell, do you have a question?
Yes, does anyone have any thoughts or observations on the information on the comparative nature of hospitals in our general area? It's been in the Post-Star recently. I think Saratoga's hospital versus Glens Falls Hospital in terms of ranking, diseases contracted while in the hospital, and it just was kind of a...
What do you mean, the article that was in the paper over the weekend?
Yes.
Opinions, or I mean, I don't know.
Patients, yeah.
I don't have I think it's probably the luck of the draw. You can make statistics do whatever you want. You can maybe look at it as far as staffing goes. I don't know if it'll be interesting. I couldn't say. It'd be interesting to look at the comparisons for the last couple of years and see where we are. I'm more interested in that than I am just one.
It would appear that MRSA, is that the staff infection is...
MRSA could be, a lot of MRSA is community acquired, which means that the person, they might find out that the person has MRSA when they're in the hospital, but they might not necessarily have gotten it from the hospital. We have a lot of questions from the community schools and different places that they'll call up and they'll have heard that somebody has MRSA, and it sounds really nasty, and it's certainly nothing to be fooled with, but it could be anywhere.
Thank you.
Okay, regarding, moving on to staffing update, we're holding our own. We haven't recent resignations since we had our last meeting. That's a good thing. We have hired a new nurse and another one because we have permission to hire them, and again, haven't been able to recruit, but we have one value that's going to be starting
January 2nd.
Good. So that's a good thing. Our per diem staff continues to be invaluable and cost effective. As far as I think that's pretty much it, except that we have our wrap now on our car.
Oh, good.
So as of last week, totally covered by the grant.
Sure is.
So you'll see it, and you can't miss it driving around. It'll be all over the county. But it is, we want to pitch, prevention, and again, it was really easy to go on, and our understanding, they were able to get the Homecare sticker off with no problem and no dents or scratches or anything. So here's the back of it, and you'll see it has Warren County and it has Public Health logo. So anybody has any questions, be sure if you see it around, tell people that you should get their screenings, and if they don't have insurance or appropriate insurance, they should give us a call.
Very nice. Any committee members have questions? I guess we're good then.
That's all we have.
Thank you kindly. Have a nice Thanksgiving.
Kevin? Hey, Kevin?
We had a question before in social services. When are we going to start the process of hiring a director?
No, the hospital has grant funding, but what we want to do, we put our numbers in.
Okay, personnel you mean?
We'll be able to tell.
Personnel?
I don't know. Don't get involved in that stuff. That's all done through the personnel chairman.
Personnel department.
Personnel, I guess.
Yeah, okay, all right.
That's Jackie. Go with Jackie on that.
Yeah, I thought they were going to put an ad out.
What's that for, Kevin?
I was asking about a social services director.
I haven't heard anything either. I'm
Somebody,
chairman of that department.
they run all that stuff. So I'm just along for the ride.
I'll see what I can find. I don't know. We have one last thing coming from, all right, and it's a request to create 2 new positions of van driver per diem at a salary of $12.51 per hour. That's be the CSEA grade 2. She did talk about it the last time she came to the meeting, if you remember right. It's not adding anything to the budget. It's like taking money away from the drivers who don't make it to drive that day. She would be using that money to fill in with these 2. That was my understanding.
I thought we already did that.
You did approve one. The problem is she had more than one candidate, and initially she thought since it was per diem, you could just swap people in and out of that position, but personnel said afterwards, each one of those people needs to have their own per diem title, so that's why it's still no more money. She's using the same pot of money, it'll be sometimes a different person.
All right, so Claudia's making the motion, second by Supervisor McDonald. All those in favor?
Aye.
Aye. Opposed? Carried. Anyone have anything they wish to bring up? If not, I'll entertain a motion to adjourn. Supervisor Bramer, second by Supervisor McDonald. All those in favor?
Aye.
Opposed? Thank you.
No, I don't want to end.
Have a nice Thanksgiving, all. Rush over too.
Amy. Thanksgiving, guys.